Hello everyone! Today I would like to introduce you this mystery machine called general anesthesia machine, which allows us to proceed inhalational anesthesia. Today I would like to tell you about the basics, how it's built, how it works, what kind of elements are inside the machine, and for what kind of patient are we going to use. At the beginning, I would like you to remember that it's not only a machine which allows us general anesthesia, it's also a life-saving machine. Why? Because not only general anesthesia is possible with that machine, but also artificial ventilation of our patients, which needs this in life-threatening situations. Because a part of general anesthesia, we are able to artificially ventilate our patients, give them pure oxygen if it's needed in life-threatening situation during CPR procedures. But also, we are able to monitor the ventilation and ventilate them if they need this in the patient with lung problems or in the patient with neurological problems which they are not able to breathe for some time. So I would like you to remember that this is not only general anesthesia, but also it allows us artificial ventilation of our patient. Even though if you proceed infusion anesthesia using all of the drugs, all of the techniques, and suddenly during your surgery, your patient, the depression of airway system, of breathing is so much, you are able to immediately use your anesthesia machine to maintain basic life function of your patient. So it is very nice to remember about this, that it's not only general anesthesia machine. 3 words about the term machine or anesthetic column, because in the literature you will meet these 2 terms. We called about the column not only the machine when we have extra monitoring devices, extra ventilator devices. So it's not only general anesthesia machine anymore, it's styled to be anesthetic column. This is the difference between these 2 terms. Now I will present you basic elements of each machine, of each column, which we are used. Independently on the company, independently of the size and dedication of this machine, we have the same elements. First and most, we need to have the source of the gas, of the fresh gas. I'm thinking here about the pure oxygen or medical air. We are able to harvest them from the bottle cans or from the special inner wall pipelines dedicated only for oxygen and medical air. This is very sophisticated and very highly technician pipeline system. That is why when you heard lately in media that each country and each government try to organize temporary hospitals, so believe me that the biggest problem inside is this type of pipelines used for the oxygen and medical air. So we have that the oxygen and medical air from the pipeline system or from the bottle cans. All this fresh gas goes to the flow meters, which allows us to adjust the flow of the oxygen or medical air, which allows us to adjust it for our patients, which are very different. Because on this type of machine, we are able to anesthetize the patient about 100 grams body weight till 200 kilograms. You can ask me at that time what we are going to do with the horses or with the cattle. We have special machines, anesthesia machines, dedicated for horses and for large animal. The difference is only with the size of the airbag and of the breathing system, and also diameter of the valves and of the pipes. But the elements of the machine dedicated for large animal is absolutely the same. So we have gas source, we have flow meters, and a few words about the most important part of each general anesthesia machine. These are the vaporizers. This is the magic place where the chemical reaction happens. You know that widely used, commercially used, and most commonly used on a veterinary market now, we have two anesthetics, including isoflurane and sevoflurane as well. But you can tell me, okay, you are talking about the gases, and here we have sheer fluid. So that is why this is the magic place, when all the magic happens. These are the vaporizers. Inside the vaporizers, we put the anesthetic, the fluid, and inside vaporizer it vaporizes, and the fresh gas flow catches the gas fumes, the anesthetic fumes, and it goes to the airway and to the lungs of our patients. And now, 3 words about how it works. We called that each anesthesia device is equipped into universal bridge, allows us to connect and to disconnect each type of vaporizer. It depends what our patient needs, in what kind of condition is our patient, and what kind of surgery are we going to anesthetize. So this is the heart of each anesthesia machine. These are the vaporizers. The next element, which is obligatory in each anesthesia machine, is breathing circuit. We have basic elements inside this system. First of all, it is carbon dioxide absorber. Carbon dioxide, what comes from? It comes from exhale of our patient. After each exhale, the CO2, the carbon dioxide, occurs inside our circuit. And we don't want to have carbon dioxide in inhalational flow. So that is why we have carbon dioxide absorber. You know how it works appropriately when you put your hand onto the absorber, because this is the exothermic type of reaction. Inside the absorber, these lovely crystals which we have, we call them soda lime. You can buy it commercially, different companies and different colors. What does it mean? Soda lime has its expiry time, so it means after 8 or 10 hours of constant anesthesia, it does not absorb the carbon dioxide anymore, and we will recognize it with color changing. So inside this, it's indicator. It's going to change color when it's expired, and it is extremely important to change it at regular basis, because we don't want to suffocate our patient. Another element which is equipped our breathing system is ventilator or artificial ventilation machine. So our ventilators are different. Of course, they are the size of our ventilator depends on the size of the patient which we have on the table. The other elements are the special valves, not only inhale and exhale, but also the security valves, and breathing back, Here, as you can see, is for small cat, but also immediately, if we have a need, we can change it for bigger volume, dedicated for larger dogs and for larger animals. If you ask me about the horses, yes, they are much larger. They are from 15 to 30 liters of volume. So everything depends on our patient. Another element is a pipeline system, which gives all of the gases into the airway of our patient. And of course, during the exhale of our patient, used anesthetic gases goes into the breathing circuit. It is the circuit because everything is inside the circuit. So that is why we have carbon absorber, ventilator, reservoir bag, and pipeline system. It allows us to control the ventilation and sometimes to control, maintain, and to support the ventilation of each patient during the general surgery. To sum up, it's not only the general anesthesia which we're talking about. Also, this machine allows us to maintain basic life function. It contains the basic elements like the gas source, flow meters, vaporizers, breathing circuit, including ventilator, carbon dioxide absorber, reservoir bag, and pipelines system. The last element, we want to know how our patient sleep, what is going on with our patient during the anesthesia, and how it feels. So that is why we have monitoring system. But it's another story. Today, I would like you to remember only the mystery of general anesthesia machine. Thank you.